Hey Lucas, so obviously you talked to Dr. Turner and Dr. Calabera about your Marfan syndrome. Well, I'm here to give you and your parents additional information about it, especially the long-term effects on it, because obviously, Marfan syndrome isn't something that we can cure 100%. So like we have to make sure like you know what's up. So let's talk about like what some the surgeries that Maddie was talking about. So first of all, let's talk about the aortic repair, aneurysm repair surgery. So I can assure you that because of this surgery, people with Marfan syndrome, their life expectancy has increased. Like we've had successful results in increasing the lifespan of people with Marfan syndrome by doing this surgery. So I assure you that this is a good way to go. It like helps with your heart issues. I feel like this is a good surgery to take. And what about the scoliosis surgery? Like after that surgery, there might be some issues with their lower back at first. There may be some pain, but that can be easily treated with exercise and like other like easy treatments that we can definitely give you without like medication or like extensive therapies on an ongoing basis. So let's talk about this pectus excavatum surgery. So yeah, of course there's gonna be some pain afterwards, but we can treat them with like painkillers and other medical stuff that like basically can relieve the pain. So like there's not been many complications of this operation either. There's been like no instances where patients require a blood transfusion. Any infections are pretty rare. Like so it's a pretty safe treatment option. So like I would definitely recommend this for sure because obviously I don't want people to see your inverted chest and feel like kind of awkward and stuff like that. But I feel like it's also really bad for your lungs as well. So I assure you that it's a safe surgery and like you should trust us on this one. This is gonna be really good for you. This is all good news. So after you have most of these surgeries, of course you have the glasses as usual. You have to wear those every day. But like after like all these surgeries, we want like and everything goes well and it definitely will go well. So like we definitely want regular checkups, right? Because Marfan syndrome, we can't 100% cure the Marfan syndrome, so we should probably do like regular checkups with us and like other medical experts in all the parts of your body where like you currently like are having issues with. For instance, you should check after your surgery. You should check up with a heart specialist to routinely check up for your heart valves and aorta and like you should also have routine echocardiograms so we can make sure our heart is healthy. Then also we need annual checkups with an orthopedist, a bone specialist, uh, so we can of course check on your pectus excavatum and also your scoliosis, see if they healed properly, see if the surgery worked, and make sure for the rest of your life those parts of your body are healthy. So and also of course your eye, you probably want like you should probably check of your eye routinely so you can treat the eye problems earlier. Some of the treatment options Bryant and Maddie said earlier, Miss Dr. Calabero and Dr. Turner said earlier, you should probably do with those, and you should also go look at an eye specialist so you can treat those eye problems early. So to recap, you should go look for a heart specialist after surgery, you should go look for a bone specialist, and you should go look for an eye specialist. So in case there's an emergency, like you should like you guys know like we should call 911. You should ask for like ambulance and stuff like that. Like also like avoid like strenuous activity like weightlifting, football, skiing, and like just physical contact sports. But that doesn't mean you don't need to exercise. You need to exercise because one of exercise makes you feel better. You need to manage your weight because those added weight can add more pressure on your bones, which is already very weak at the moment. So like talk with us some more if you want like additional recommendations. I would recommend you just like find a trainer and see like and tell the trainer your situation so they can manage your weight and manage your exercise accordingly so you don't have too much strain. So like just make sure and also like make sure like you do physical activities that can like increase your blood pressure because that can put extra strain on your heart. So yeah, low impact activities like for instance golf, hiking, maybe some tennis. So like those are some activities that I would recommend. So So yeah, so I would just it's constant communication. We need communication between your specialists, between the trainer, between us, so we know what's going on with you, so we can help you the most. So yeah, so this is basically all the information I want to convey with you. Hopefully you accept the treatment options. I can assure you that like everything will be fine. Thank you.